very good. A couple of questions for you. You mentioned a 30% increase in your healthcare costs, but the company had doubled. What time period was that over?
Over the last 5 years.
5 years. Okay, very good. And then one of your slides mentioned a national physician network.
Right.
Can you elaborate on that?
Yes. So when we got the Cost Plus, we signed up with the Cost Plus plan. We also signed up to have a physician network that's nationwide. So we have employees that work remotely, and that was very helpful, where they could have access to a national network.
Okay. All right. Well, I've got a couple of questions, or several questions from the audience, and I'm going to pose some jump balls out there if anybody wants to address these as we go through. And I think this is a very timely question. One of the concerns with wellness programs, one of the concerns is the sharing of information with insurance companies. And I think with privacy concerns and everything else out there, you never seem to leave that concern with anything. So if you can, any one of you or all three of you talk a little bit about how you've addressed that in your companies. Not necessarily looking at you, Jane.
Well, with the city of Houston, the actual healthcare provider, we don't see any of we can't see any of the private information. It's only with our healthcare provider. The numbers that we receive are numbers that from the actuaries, and they've just kind of told us this is where your claims are going. You either as with our wellness right now, we have a program that's going on that shows that we have a department that has a lot of people that are borderline diabetics. And so we then kind of do a specialized plan for that particular department to engage them, because in all actuality, it's like looking for a needle in a haystack. We don't know whom we're looking for. We know we have a department that could have 1,400 employees, and the data tells us that we have 71 people that are borderline diabetics. They're not, we're reaching out to them, or the company is reaching out to them, just trying to talk to them over the phone, engage them, but we've done a really good job. We don't know who they are, and that information has stayed very, very private, but we're able, based on the data, just to be able to target specific departments just by what we receive.
Okay. Anyone else have any thoughts or comments on that?
We use aggregate reporting to drive our wellness programs, but the other thing that we've done to encourage participation is we have a wellness wall where people share stories about how wellness has actually changed their lives, or helped them improve their lives. And because of that wellness wall, people are encouraged to actually engage in the wellness program, because they feel like their peers are the ones, have had a change and have seen changes. So they are encouraged to do that. And it's not so much us driving them or trying to make them do anything.
Okay. In general, and I think I heard it from all three of you, that there have been increases, say, over the last 5 years, and I think that's consistent with the market. What have you done as employers to share that cost, absorb that cost? Just, you don't have to give specifics, but in general, passing on most of the increase, or passing on very little of the increase, and just adding wellness programs, or what's been the philosophy there?
We've done a little bit of both. During healthcare reform, we were a grandfathered plan, so we were only allowed to tweak our premiums within certain percentage ranges. So because we wanted to keep the grandfathered status, the firm bore more of the financial burden. We do pay a lot more in coverage for our employees, and then subsidize less for the dependent coverage. But we just kind of have to look at it each year and determine what we think is a tolerable increase for our employees with what their compensation level is, and what the firm can bear with our budget. We previously, before we went to the all consumer-driven health plan option, we did have salary tiers so that someone making 40,000 or less paid a different amount than someone making 40 to 60 and someone making 60 plus. And then the attorneys were at significantly different tiers too. And we found that that felt more fair to us. It did mean that the firm then was subsidizing more for certain levels of people, but every year it's hard, and right now in Texas with the energy prices being down, you know, it's hard to pass more of that on to people, and it's also harder on the firm if business is down, so we just have to talk to people about it, and that's why we've talked about some of the changes we made to the structure of the plan. Even though some of those weren't popular, we tried to explain the reasons for them. And we gave a lot of statistics, so those numbers I talked about earlier about the PPO costing them more on average and the firm more versus the other plan, we shared all of that data at an aggregate level so people could understand that even if for them personally that's not how the math would work out, they understood that that's how the math worked out for the firm as a whole.
Right. And obviously you guys are an ESOP, so they're sharing it one way or the other, right? So, I'm going to combine two questions together somewhat here, because the two things I've heard today is that pharmacy cost seems to be an issue for everybody out there, and I think that's also consistent with the market. And I don't remember which one of it you alluded to, some of the ancillary things as well. So along those lines, have you done anything for ancillaries, for example, for site of service differential, or imaging, MRI, PT, outpatient surgery, any of those sort of things where you're able to control or steer site of service to save costs? And then the second part of the question is around the pharmacy piece of that. Where have been the big savings in that? Is it generics, you know, influencing generic use, or just in general where those savings have come from?
Well, let me speak to imaging. Pharmacy, we're looking at a lot this year, and we are trying to think of creatively what we're going to do, because obviously that's something that we need to look at. But imaging, a few years ago, we contracted with a company where we encourage our employees to go through this company, and if they do, then we actually cover the cost. It doesn't go to their HRA account. So it's helping them save some HRA dollars, but it's significantly cheaper to go through this company for imaging. So that's what we've done, and it's worked, because a large part of our population is actually using them for their imaging.
Okay. And does that also apply for surgery, for example, to try to avoid out-of-network surgeries and that sort of thing?
Well, it depends. It depends on the kind of surgery, but yes, it could. It could.
And the city, you know, is very similar with the same program, but with reference to pharmacy, I think one thing that we've done really, really good is using generics. I think that the last time we met, that the city was almost somewhere between 80 and 85% of using generic drugs, and I think that's where we've done a really good job. But again, that gets to that collaboration and partnership, making sure that everyone, you know, understands there are some drugs and there are some, you know, prescriptions that are not generic, and you have to be able to use this specific one. But I think our company has done a really good job at looking at generics, and where we can substitute generics, they've done that. And so that's been a savings for us.
Okay. Jessica, did you have any comment on that?
No, we definitely push the generics as well. And I think that, again, with our transition to this different health plan for everyone, they're incentivized to at least ask the question now, and that's what we try to encourage them to do. And we've seen our usage go way up.
And I think one of you had mentioned, I believe it was you, Jackie, had mentioned an app that you were using or was it Jane? I'm sorry. One of you mentioned an app for tracking the wellness programs, And maybe talk a little bit about that, if there are other creative things that you've done. And I know the Fitbit, you did talk about the Fitbit, but are there other things that you can use, portals, et cetera, that you've tried to try to attack that?
Yeah, well, and our app is still, they're still, it's still in production. It's still in production. They're still working through it. But I think all of the, with the iPhone and with other portals, with respect to not only the Fitbit, but, people use different type of wearable devices. So we make sure that we engage, most of us have Fitbits, but whatever wearable device that they have, those are the devices that we're allowing that go into the program. And then now that the phones actually have, different apps on them, you're able, if you're not even wearing the device, you're able to use your phone if that's what you're carrying with them. So we just really try to think outside the box, encourage people to do those steps, because a lot of times, it's not about the running or the marathon. And a lot of our employees, participate, in the MS 150. We do a lot of things, a lot of the marathons. We do those things, but we want to encourage the person that doesn't exercise that much, that all you got to do is get those steps, and just do your steps every day, and that works toward. It really makes a difference, and we have those testimonies, also just people that just started, doing that. Another thing that we kind of do is that we actually have during lunchtime, our wellness coordinator actually has line dances, and we do, during your lunch, and you actually can actually go and do exercises, and we provide that at, during your lunch, which means, you got to have like a quick snack, because we're a governmental entity, so you kind of, got to go do that, grab a snack, and go back to your desk. But we've done that just to help to promote the wellness and so that you have something that you can actually do at work.
And Jane, I don't mean to put you on the spot, but I do remember seeing it in the paper, so I know it's public record of savings from some of your wellness programs. I remember reading an article, maybe Houston Business Journal or one of those, about the total dollar savings, and it was fairly significant. If you mind sharing some of that with us?
And just because you asked me,
you can make up a number, because I don't remember the number. I just remember it was a big number.
I don't want to make it up. Yeah, we having over 85% of our population participate in the wellness program, and then also having getting the spouses to participate. That's probably, literally it's totally escaped me. I don't actually have the number, but we really did well with the savings that we had with respect to wellness.
Somebody in the audience remember that?
I do not remember.
I remember like 7 million or something. It was pretty significant.
It was in the millions, but I'm just not sure that, that number. So, but yes, we did really well, and it's been very encouraging, like I said, to get a population there, 22,000 plus city employees. And, we have a lot of employees that are on our plan and that are not on our plan, but we've been able to get everybody to participate.
Okay. And then, I'm sorry? 42 million. There you go. So, I guess low.
That's a lot of people.
As taxpayer, I thank you for that. Yeah. Okay, let me see here. We got just a few minutes. I'm going to pick some of these questions out of here. For Jessica, you talked a little bit about healthy eating and some of those programs in your wellness program, and this actually could be for anybody here. Have you looked at any kind of shopping assistance type programs or any software that are driven around that, or any programs for teaching people either healthy cooking, healthy shopping, or anything related to that?
No, I would be very interested in that. We have done some recipe sharing and things like that internally, and the program that I mentioned mainly teaches you that sugar's really bad for you and how much sugar is hidden in things, so that you know how to read a label. So it does teach you about that, and it basically is, eat when you're hungry and stop when you're full. So other than that, it's a pretty simple program. But we do offer like healthy snacks and things like that in our lounge. We do not have anything, cookies, candy, vending machines, that's not on our property. If you want that stuff, you may eat it, but you have to go somewhere to get it. We don't make it easy for you to get it, but we do make getting fruit, oatmeal, peanut butter and apples, those kinds of things easy for you to get if you're working late. If there is, if there are those kinds of shopping apps and it's been, made for people that's corporate, I would love to know about that.
Okay. Now, whoever wrote this question, and pardon me, I may give somebody a free plug, but I do not know anything about this. They said shopping service like Castlight. Is anybody familiar with that? Okay. So that was one that was, so you can explore that.
Where you can go in there and shop prices for like an MRI.
Right.
Oh, whoa, okay, for actual healthcare service. I was thinking the wellness part of it. Okay.
So we use Compass Health for that right now.
Yeah, okay.
And that has also helped. We don't pay for it we pay for Compass, we don't pay for the service that they go to, but because they're incentivized to save that HSA money and not pay their deductible, we've had a lot of use of that because it's a free service for them.
Okay. So in the last few minutes that we have, I'll pose one question to all three of you, and I'll put you on the spot again, but this is unscripted. Over the last 5 years in your wellness programs and your health programs overall, what would you not have done over that time period?
I'm going to just go out on a limb. I don't think it's anything that was within our wellness program that we would say that we would not have done. I think everything, each year, what we did, we kind of just thought more outside of the box and more outside of the box. So it's kind of a step process. You actually have to just keep, you meet this milestone, and it's like we're doing right now. We're all sitting in a room and go, okay, what do we do next year? So I don't think it's anything that we wouldn't have done. We just have to keep trying to work together to figure out what's next. And will we ever run out of those ideas?
Yeah, that's fair enough. Yeah, and I guess to help in that question, and Jackie, you mentioned you guys were self-insured, fully insured, and then you went to more of a self-insured, but I guess being fully insured taught you some lessons along the way.
And you know what else I would probably hesitate. We were giving very high rewards for like participation in biometric screenings, and the unintended consequence of that was we ended up just creating a lot of entitlement instead of ownership, which is, we were going for ownership, but we had to undo that, and that was a lesson learned.
Very good. Right.
I also think we probably bit off more than we can chew sometimes in terms of challenges. We want to do everything. Let's do a water challenge, a step challenge, a sleep challenge, and we have a pretty small HR department, so they take a lot of that on, and it's a lot more work than you think, that it's just sending out an email and it's over. There is more to it to make it successful and to get people to buy into it. So I think we now are smarter about how often we do programs like that, and instead of having a lunch and learn every month and just trying to find someone, we find really good speakers, twice a year and make the program valuable. And that's less work for our department, and it's probably more impactful for our employees.
Okay. Well, very good. Well, thank you again, Jane, Jessica, and Jackie. I didn't realize that till just now, the three J's, and that was also not planned, but they will be around somewhat after this session. I think we have a brief intermission.